The highest one-day death toll in France so far. 365 people have now succumbed to the coronavirus in 24 hours. But France's top health official warns the actual toll in the country may be far higher. New York hospitals under pressure. Patient admission rates shoot up by 40% as across the United States, a record-breaking 3.3 million people apply for unemployment benefits. And in other world news, Benny Gantz becomes the Speaker of Israel's parliament, a surprise move suggesting a possible unity government with arch-rival Benjamin Netanyahu. Hello and welcome to our continuing coverage of the coronavirus outbreak around the world. And we start for you here in France, where 365 people have succumbed to the virus within 24 hours, and that includes a 16-year-old girl. This is the largest one-day rise in France so far, bringing the total official death toll in the country to 1,696. But France's top health official has warned the actual figure is likely to be far higher because the current total doesn't include anybody who dies in their house or in a care home. Well, he addressed the French public earlier on Thursday evening. Let's take a listen to a little of what he said.
In France, as you know, we are dealing with a major epidemic on a national level, which continues to get worse. We've mobilized all of our health resources, all of our public and private establishments, thanks to the so-called White Plan. We've put on hold all of the non-urgent medical and surgical services, and we're progressively turning to population monitoring, what we call the symptoms monitoring method, which allows us to identify treatment, consultations and trips to the ER, and to rely on laboratories in the city.
Well, now let's bring you the latest figures from the current centre of the outbreak, and that's in Italy. Over 6,000 cases have now been confirmed within 24 hours, and more than 700 people have lost their lives in that time. The total death toll in Italy now stands above 8,000. That's more than double in any other country in the world. Authorities in Rome, though, say they hope social distancing measures can slow the number of infections, what's known as flattening the curve, in the coming weeks. In the United States, cases of COVID-19 are doubling something like every 3 days, and the governor of New York has warned the state will run short on ventilators if the number of patients continues to rise at the same pace. So to try and prevent the hospital system buckling under pressure, a Navy hospital is headed for New York's port. Jean-Emile Jamin has more on the situation in New York.
Overwhelmed and under-resourced, New York hospitals entered into Thursday, struggling to contain the spread of coronavirus, with authorities reporting an additional 100 deaths and over 6,400 new cases. The need for hospital beds and ventilators has been particularly acute, with Governor Andrew Cuomo revealing new improvised methods to ensure patient survival.
We have approved a technology that allows one ventilator to serve 2 patients, what they call splitting, which is where you add a second set of tubes to a ventilator to do 2 patients. It's not ideal, but we believe it's workable. We're also converting anesthesia machines to ventilators.
If New York State was a country, it would currently have the 6th most infections in the world. Numbers like these have doctors on the front lines scrambling for equipment and, more importantly, time, as difficult decisions need to be made.
People come in, they get intubated, they die, the cycle repeats.
Unfortunately, it might get to a situation you have to pick and choose what you're going to do, how you're going to do. And as the doctor said, a lot of people come, they not really survive, they expire, and you put the same machine on another person, and you cannot really even cope with the situation because it's so hard to think about this.
The US Army, meanwhile, announced that 2 field hospitals were on their way to assist the city, including as many as 700 personnel and almost 300 beds.
Well, millions of us are now self-isolating, only going outside when it is absolutely necessary. But how do you keep yourself safe when you do end up going outside? Well, to try and get some clear answers and to talk a bit about how long this might all be going on for, let's speak to Mohammed Munir. He is a virologist at Lancaster University in the United Kingdom. He joins us from there. Hello to you, sir. Thanks for joining us.
Hello.
First of all, what is your advice for people when they go outside? Social distancing, for example, in the supermarket can be pretty tricky. Should we all be wearing disposable gloves when we go out? Should we clean our phone if it comes into contact with anything when we're outside?
Yes, I think this is really important now to really ensure that the chances to contract the infection can be minimized. And there are certain measures that I want to really count on so that people can remind yourself and then really practice them. The first thing is that we know that the virus now can stay onto the plastic surfaces up to 2 days. So, for example, trolley handles or the basket handle, these are one of those places where virus can stay. If they carry the sanitizer or the wipe with them, they can clean them up. And also, when you are picking the stuff from the shopping aisles, ensure that only pick the one that you want to buy, because if you're going to touch anything that you're not going to buy, then you're going to leave some possible contamination over there. And really observing the distance of 2 meters while you're shopping, avoiding the busy hours and busy aisles. And also, I think one of the important things is to really ensure that we now have quite strong evidences that currency could be a source of transmission. So sticking with the contactless payment system, that is another option to really minimize the risk for contracting the infection.
Do we have any research about whether or not this virus can live for very long on our clothes? Should we be taking our clothes off when we come in the house and putting something else on immediately?
Well, there isn't any particular study that's been conducted for how long a virus can stay onto the clothes, but I can tell based on my virological knowledge is that it stay enough to transmit to other people if it is not kept for that long. And therefore, I think keeping the clothes clean and tidy is, of course, important at the same time any other contaminated surfaces are.
We understand why governments have been talking about possibly trying to lift some of these very restrictive measures within weeks and months to try and protect economies. But you know very well that there is no vaccine out there at the moment for COVID-19. So do you think from a scientific perspective, we have an exit strategy in terms of the way that we are living our lives in these extraordinary times?
Well, thank you very much for bringing this one up, because this is really important to understand that locking down cities, countries, and really applying stringent measures to have the physical or the social distances are not going to be fruitful on their own until you really apply massive testing approach and identify the people who are carrying the infection, either isolating them, the one that are carrying infection, or the one who are having symptoms, to treat them. So unless you apply the testing and isolating those people, only locking down would take a longer time to start seeing any benefit of it. And we, I think, are, depending on which country you talk about, we are like 3 to 4 weeks into the lockdown. But that required another 3-4 weeks, the same scale, before we start seeing any decline in the number of cases.
All right, Mohammed Munir talking to us there from the University of Lancaster. Thank you very much indeed for sharing your expertise on France 24. Now let's bring you some news not related to the coronavirus, because Israel has got a new parliamentary speaker, this after months of political deadlock. Benny Gantz was named to the post in a surprise manoeuvre, suggesting a possible unity government could be on the cards with his arch-rival Benjamin Netanyahu. From Jerusalem, Iris Makler explains.
He will be the speaker. His party will have important portfolios such as the Justice Ministry, the Communications Ministry. Both of those are relevant to the corruption trial that Benjamin Netanyahu will face in the upcoming months, as well as running the government during the corona crisis. So those are the positive things. What it means, of course, is that he has had to give up a very important thing. Perhaps the reason that he came into politics was to see Benjamin Netanyahu leave government, and he promised he wouldn't serve under Benjamin Netanyahu. So in his speech just an hour ago, I think I heard the word corona more than 5 times, and he was basically saying, I took this decision, a difficult decision, an unpalatable decision, and I took it for the good of the country because we need a budget. People are suffering. There's no money here, as there isn't in the whole world, but there's no stimulus package here either because there isn't a budget for it. And he said the good of the country is what made me make this terribly difficult decision. But you have to also say that he did blink first in the long grass and that Netanyahu has won another round.
Well, with that, you're up to speed with all the top stories we're following for you on France 24. Do stay with us. Much more still to come.